What's crazy to me is that we're working against both the virus and a political movement that has become an adjunct to the virus. We have been all along, and that's what we have right now. Dr. Peter Hotez is a professor of pediatrics and molecular virology at the Baylor College of Medicine, where he's also co-director of the Texas Children's Center for Vaccine Development. London Lamar is a Democratic state representative from Tennessee, and they both join me now. And Representative Lamar, let me start with you about just how has this happened in your state? Where is this pressure coming from, this backlash towards the public health officials, and particularly Dr. Fiscus?
Absolutely. It's sad that I'm back on the show because, once again, Tennessee Republicans are making us the subject of embarrassing national headlines by playing political football with the lives of Tennesseans. Last month, in the Government Operations Committee, which I was sitting in, the Republicans were asking questions of the Department of Health about the information they're giving out to minors about vaccine distribution. They had concerns and they did not appreciate the department, what they said was marketing to teenagers based on this mature minor doctrine. Well, at the time, we only had 8 teenagers reported that have taken the vaccine without their parents. 3 of those children were the commissioner of the Department of Health's children. So what we are doing is, because the Republicans don't believe that COVID-19 is real and we're making political statements with this disease, we are now making Dr. Michelle Fiscus the latest victims of what they are trying to do by limiting all Tennesseans' access to the vaccine. Right now, this is unconscionable. Right now, we are still in the midst of a pandemic where Tennessee is number 1 in the country for the highest rates of vaccines. And it's immoral and irresponsible that we're denying basic humans the ability to get educated and receive healthcare access if they so choose. Again, our Republicans claim to be the party of pro-life. Well, if you are the party of pro-life, be for children and don't deny them information, access to life-saving healthcare opportunities that can, in fact, save their lives. We see right now in the state of Mississippi, there are 7 kids in ICU right now, 2 on ventilators because of this new Delta variant of COVID. Those are going to be the same stories that come out of Tennessee as we continue to restrict them from having basic access about how to access this vaccines. Dr. Fiscus wasn't pushing to recommend anybody do anything. It's your personal choice to get that vaccine. But what she was reminding her coworkers about a law that was already in the books about the mature minor doctrine. And that turned into a political war here in Tennessee. And it's going to affect the lives of all people. In fact, potentially kill some people.
That is really interesting and useful information that there were only 8 kids in the state that were actually showing up and doing this. And this was guidance for essentially an edge case that some of your colleagues saw an opportunity to wage culture war on, which has now resulted in this. Dr. Hotez, let's talk about the sort of public health dynamics of this moment, particularly in the American South and places that have lower vaccination rates, as you predicted. And to me, the sort of silver lining, the thing I'm holding on to, is that example from the UK and this data that we got from Kaiser Family Foundation, right? Adults 65 and older accounted for 16% of the U.S. population, 80% of COVID-19 deaths in the U.S. We have, luckily, high rates of vaccination among the most vulnerable population. Do you anticipate we are not going to see the kinds of mass hospital overruns and huge death toll like we've seen from other waves?
Yeah, that's right, Chris. The character of the epidemic will be different, and the deaths won't be as high. But as I like to point out, just looking at deaths alone is a blunt instrument, because we learn so much more about COVID-19 in terms of the more subtle yet very severe morbidities and what many people call long-haul COVID, with chronic and long-term neurologic deficits, heart palpitations, shortness of breath. The neurologic deficits really concern me. A new paper coming out of the Oxford University group has shown that long-haul COVID can actually lead to commonly gray matter brain degeneration that almost resembles Alzheimer's disease in some aspects, associated with cognitive decline, memory loss. And that was looked at more in adults, but now we've got data from JAMA, the Journal of the American Medical Association, showing that about 26% of young adults are getting long haul COVID. We don't have good data on the adolescents. Some people say 5 to 10%, 15 to 20%. But, who wants to risk that? This is a time in their lives when they're applying for universities or taking their SATs or getting jobs after college. This is not a time in your life when you want to be suffering long-term neurologic deficits, which are entirely preventable through vaccination. And, only 20% of the adolescents are vaccinated in the state of Tennessee compared to 3 or 4 times higher rates in the Northeast. So we're going to subject all of these adolescents and kids and young adults to the effects of long-haul COVID and in terms of thousands and thousands, and it just doesn't have to be this way.
The final question for you, Representative Lamar, is there something that could be done in your state to boost vaccination that's not being done, particularly by the state's Republican governor or officials?
I think, unfortunately, because we can't depend on our state legislature and our governor and our state health department to give adequate information about how to access vaccines if you so choose, we unfortunately have to take personal responsibility for our healthcare. So I'm calling on all citizens, parents, teachers, healthcare officials, doctors, to remind everyone that you have the right to go get this vaccine, and you should, to protect yourself against the COVID-19 virus and this new deadly Delta strain. What we can do is save lives. And what we can do is get on social media. We can talk to one another. We need to talk about it in our churches, in our community centers, everywhere, so that we can protect ourselves, because what you've seen this week is we cannot depend on our government to protect us. They are putting our lives at risk. They are making political statements with our ability to access vaccines in the midst of a deadly pandemic. So we must do this ourselves. It is my job as a legislator to continue to inform our citizens on how they can access the vaccine. But I'm so disappointed in the leadership of the state of Tennessee and what we are doing by refusing to give our babies the ability to protect ourselves. When we still got 30,000 kids who still need the measles vaccination, can't get it because of the pandemic, or those who need HPV. So we have a lot to do, and this is a moral war that we have to keep pressing in order to get it done for our kids.
We reached out, of course, to the Tennessee Health Department. They said, to be clear, we have in no way halted the Immunizations for Children program. Tennessee Department of Health understands the importance of childhood immunizations, the impacts to overall health for Tennesseans. We continue to support those outreach efforts. They have suspended the information on teenagers. They sort of characterize it as a kind of tactical retreat in the face of the backlash. Dr. Peter Hotez and Tennessee State Representative London Lamar, thanks for making time tonight.